It's not cytokinesis. Cytokinesis is part of mitosis. Meiosis? Meiosis is happening only in the sperm and the egg, in the reproductive. We don't know. Who said we don't know? That's half of the knowledge. Half of the knowledge is we don't know. You know what's the best of the knowledge? God knows best. Okay, on the exam put God knows best. Yeah, that's true. But you're gonna fail because you're here to be tested on whether you know or not. Listen, the two phases of the cell cycle are mitosis and interphase. So interphase, remember, is divided into G1 and S and G2. You guys were saying Obama something. You're making some words. No. Okay. So some tissue can enter the cell cycle over and over again. What is that tissue? Your bone tissue can heal. Your skin. How about your skin? Have you been injured and the skin never regenerated? It does. Who can never enter the cell cycle again? Your nervous system. That's why you get a stroke. What's a stroke? Stroke is dead brain tissue. What's a heart attack? That's dead cardiac tissue. So those can never regenerate. So if you don't regenerate, or even your skin, if the injury is so deep that it took off even the epithelial and went down and removed the stem cells. So you cannot regenerate now. What are you going to heal by? You're not going to heal by regeneration. You're going to heal by fibrosis, scar, tissue formation. Scar tissue formation. What are you saying? Graft. You're talking about skin graft. Yeah, skin graft is when we remove the entire epithelium. There's really nothing there. Even stem cells, even the basement membrane is not there. Then you put a graft. Yeah, you remind me of somebody who died because of that. The doctor was a very aggressive person, and he even said it. He's an idiot. He said, "I'm very aggressive." He's a surgeon. He said, I am every problem that comes, I am very aggressive. I was in medical school at the time, and I knew that was wrong because you're not supposed to be always aggressive, right? And you're not supposed to be least aggressive. It depends on the situation. Some situation, like a gangrene, you have to be aggressive now. And like the homeless lady that her foot was severely infected because she lives on the street, and her foot the gangrene is almost about to go to her knee, and she goes to the hospital and they tell her you're fine. Yeah, because she doesn't have health insurance. So now the lady, she's walking in the street and the gangrene, so now that one you have to be aggressive. Some conditions you don't have to be aggressive. But if you are oriented as a surgeon that everything has to be aggressive, then you're going to hurt the patients. And exactly that's what happened. What I feared happened, and it was my uncle-in-law. He married my aunt, my maternal aunt, and he died because of that doctor who's aggressive. So this graft thing, he was saying that. He was saying, I'm going to remove the whole thing and you guys go and make another surgery with a plastic surgeon. So he was playing a game, actually. He was he was just experimenting. He was playing with people's lives. So it was very bad. So that graft is when what happened to my uncle is when he removed everything in the skin. You can now see the actual muscle. He didn't leave anything behind because my uncle had a diabetic pus infection and like an infection. So he needed to do like a debridement and remove all of the dead tissue. But you're not supposed to make a really big deal to that level where he made like a square, the square pizza? It's like he removed the thick square pizza from his leg. So now my uncle was walking around with a big square empty box, and he was like, how am I? He was telling me before he died, he said, how is this going to heal now? I was like, I don't know. I was in med school. I didn't know. I thought maybe he knows better. That's how you're supposed to think. You're still a student. That's a specialist. You're supposed to not overstep. But he was all wrong. But anyways, yeah. Okay. Oh my God, 8:05 now. Ligaments and tendons. They are important for the attachment of Ligament, they hook and they staple and they attach bone to, no, that's the tendon. The tendon attach bone to muscle, bone to muscle. The ligament attach bone to bone. Very good. Don't be sorry. Be happy. Because you're trying. Because if you didn't say it and I said no, wrong, you would have kept on thinking that forever. But it's better to say it. Some you hit, some it's like throwing the dart. Sometimes you hit the bullseye, sometimes you don't. Okay, but don't let me deter you. Some students said, Professor Kadir is what great at, but he has one bad habit. I said, what's my bad habit? He said he has a problem of making you feel bad when you answer something wrong or say a wrong question. Actually, that's true. Okay. So if I'm lecturing, listen, if I'm lecturing for 3 hours about Romeo and Juliet, and you ask me if Juliet is a man or a woman, am I not supposed to be shocked? Okay. Okay. Loose connective tissue and dense connective tissue. That is the tissue that's responsible for healing if what? Fibrous tissue is responsible for healing if what? If the tissue is non-regenerative. If the tissue cannot heal anymore, then we're going to have this fibrous tissue that's going to pick up and is going to, like a cement, dropping cement on the surface of the damaged tissue.
Is that why sometimes it's like when you have like a weird cut and sometimes it doesn't match with the original skin, like it doesn't heal the right way, I guess. Right?
Yeah, because sometimes if the damage is too severe, the tissue dies, including the stem cells, because all of the regeneration happens from stem cells. Then your tissue, because of chronic inflammation is so severe that you're not going to heal anymore by regeneration. You have to heal by recruitment of fibrous connective tissue. Fibrous connective tissue. That's known as scar tissue formation. So we're done with fibrous tissue that we use for healing in non-regenerative tissue. If you say scar tissue is important for healing, that's an incomplete answer, because it's only responsible for healing in which kind of tissue? The non-regenerative tissue. Very good. No, a keloid is a separate thing. A keloid is when there is an excessive hypertrophic scar. When there is an excessive, like when you set off the fibroblasts, the TGF betas, who make the fibrous tissue. Some people when they get an earring, they get it because there was like maybe a contamination in the thing that they used, and this tissue is fat. Your lobe is a fat tissue. This is not epithelial tissue. So that's connective tissue. Once it gets punctured, you have to be very careful because it heals like that with fiber deposition. So there's a lot of fiber. So now they wanted to make put like a hole for an earring. Now they have like a scar earring. Yeah. Yeah. Okay, do you want one of those? You don't want one of those. Yeah. Then there's areolar tissue. When you see areolar tissue, that's not muscular, that's not nervous, and that's not epithelial. There's also areolar tissue. What is that? That's organized fibers and is rich in blood vessels. And it is found in the underlying epithelia, in the serous membranes, between the muscles. Reticular tissue, one of my favorite tissues. This is the tissue that is found in your spleen and in the lymph node. Very good. In the spleen and in the lymph node. So it forms supportive stroma and framework for lymph organs, and they are found in the lymph nodes, the spleen, the thymus, and the bone marrow. Dense regular connective tissue. This is on your lab practical. You see that these are densely packed parallel collagen fibers. They have compressed fibroblast nuclei, and they have elastic tissue that forms wavy sheets in some locations. So the tendons attach the muscles to the bones, and the ligaments hold the bones together. So the ligaments and the tendons, they are an example of dense, regular connective tissue. Then there is irregular connective tissue, and that is found around the organs because you want to protect the organs from the damage. And you see that these are densely packed, randomly arranged collagen fibers, and um, they can withstand severe stress due to their tensile integrity, and we find them in a deeper layer of the skin and the capsules around the organs. Adipose tissue. So far we talked about how many different types of connective tissue. Fibrous tissue, that's connective tissue. Then we talked about what else? That's dense regular. That's an example of, so the dense regular, dense irregular, collagen rich tissue. Then we talked about areolar tissue. Then we talked about reticular tissue, and we ended up with, so adipose is now a different type of connective tissue. That's the fat, where in which adipocytes are the dominant cell type, and there are spaces between the adipocytes is occupied by the areolar tissue, and sometimes reticular tissue and blood vessels. So the connective tissue cells are usually not closely tied, hooked together. There is what in the middle between them? There is red blood cells between them. There's red blood cells. There's vessels, blood vessels between them, and there is areolar tissue, reticular tissue, and blood capillaries. The fat is the body's primary energy reservoir. So the quantity of stored triglyceride and the number of the adipocytes are quite stable in a person. So here you see that the fat is recycled continuously and new triglycerides are synthesized while the old one are hydrolyzed and released into the blood. You have brown fat and white fat. You see here, this is the adipose tissue. And you see that the adipocyte nuclei is centered in the middle. These are empty looking cells, and the nucleus is pressed against the cell membrane. The nucleus is pressed against the cell membrane. One excellent example is, where do we find the white adipose tissue? Usually in the mammary glands, in the breast tissue. And where do we usually find the nucleus of the adipose tissue? Pressed against the what? Plasma membrane. Again, it's the cell plasma membrane. Brown fat produces heat, and the fat tissue is important for storage, insulation, and cushioning. Hairline cartilage, that's a clear, glassy appearance because of the fineness of the collagen fibers, and it eases the joint movement, and it holds the airway open, and we find that in the trachea. And locations are the articular cartilage, costal cartilage, the trachea, the larynx, and the fetal skeleton. What is that? That's elastic cartilage. Elastic cartilage is cartilage containing abundance of, it is cartilage that's containing an abundance of elastic fibers. It's covered with the perichondrium and is found in the pinna, the auricle of your ears. That's found in the external ear and in the epiglottis. Fibrocartilage. So that's the cartilage containing large, coarse bundles of collagen fibers. They resist the compression and absorb the shock. Locations are pubic symphysis, the menisci, and the intervertebral disc. Bone tissue. What type of tissue is bone tissue? Connective tissue. Is bone tissue epithelial tissue? Is bone tissue muscular tissue? Is bone tissue nervous tissue? So it's got to be what? Connective tissue. We have two types of bones. There's spongy bone that's delicate, which is made up of delicate slivers or plates that give it the bone a spongy appearance. And the bone is known as osseous tissue. That is a calcified connective tissue that composes the skeleton. It's compact bone that is a denser calcified tissue with no visible spaces. Compact bone. These are cylinders that surround the central osteonic canals that run longitudinally through the shafts of the long bones. Blood vessels and nerves are going to travel through the central canal. So you see your bone tissue is rich in nerves. So when you break the bone, you have a lot of nerve palsy, and you break the muscle, and you rupture the blood vessels, and you have a hematoma. You have blood that is like a blood tumor, like a swelling of blood clot that is going to be at the site of the fracture, the injury. What about the blood tissue, the blood smear? We looked at the in the lab today. The blood is an example of a connective tissue. The blood is an example of a connective tissue and is one of the most major important connective tissues because the blood is rich in red blood cells, white blood cells. What else? Students say plasma and platelets. Platelets are like band-aids. They are band-aids that once they stick to this, if there's a laceration or a contusion or a damage of the endothelial tissue or of your blood vessels, then blood is going to leak endlessly. You may have an external hemorrhage or internal hemorrhage. If it wasn't for the platelets, they will form a thrombus, and these platelets are gonna stick together to prevent the loss of the blood. Platelets are not even cells. Red blood cells are cells. White blood cells are cells. They are made from the bone marrow. Red bone marrow gives you the red blood cells. And the white bone marrow gives you the white blood cells. But the fragments, the platelets, they don't come from the bone marrow. They come from fragments of mega karyocytes. These mega karyocytes are giving us, they break into pieces that would later turn into platelets. Nervous tissue. How far are we doing? Oh God. Oh good God. Help us. 10 minutes. Come on. Nervous tissue. Nervous tissue is specialized for communication by electrical stimulation. So there's an input, sensory input, processing, integration, control, and then a generation of an output. That is what the nervous tissue does. The neurons are nerve cells, and then there's the neuroglia. They protect and they assist the neuron. You have to know the difference between neurons and neuroglia. Neurons are the actual nerve cells of your brain and your spinal cord. Neuroglia are supportive cells. In this school, we don't only have professors and students. We also have psychologists and human resources and administrators, and you have supportive staff. Same thing. Your nervous tissue has neurons, nerves, and supportive cells to the neurons. What are they known as? Neuroglia. Is neuron tissue, is nerve tissue regenerative? No. So when you get a stroke, you get a stroke. Did you guys hear of brain tumor, brain cancer? Then I thought cancer is uncontrollable cell division. But the neurons don't divide. How does that happen? I'm sorry? I'm sorry? You guys are mumbling things and I can't hear you. Say it so I can tell you if it's true or false. The connective tissue around the nervous system brings in the cancer. It's the neuroglia who do that. Very close, but it wasn't the connective tissue. It was the neuroglia. These supportive cells to your neurons, your astrocytes. That's the neuroglia. Schwann cells. That's the neuroglia. Oligodendrocytes. These are neuroglia. They are capable of cell division. In fact, it's very strange. There is more neuroglia than neurons. It's very strange. Here you have students and professors, but you will never have more administrators than the students and the professors. But in your nervous system, it's the other way around. You have more neuroglia to maintain and housekeep and protect your nervous system than the actual number of cells. And they are the ones who undergo continuous cell, because they need to divide. These supportive cells, they need to divide. Once they divide, they invade the brain tissue. They invade the nervous tissue. So that's the neuron. And you see those little glia cells? Those are supporting the neuron. Neurons don't divide, but the glia divide. Muscles, we have three types. Skeletal muscle, smooth muscle, and lastly, cardiac muscle. What's the difference? One difference. The skeletal muscle is under your voluntary, conscious control. You can flex and extend the joint. The muscle tissue is like a rope that pulls your bones. But smooth muscle tissue, is it under your direct control? Can you tell your blood vessels, please vasoconstrict, please vasodilate? No. Can you tell your cardiac tissue, please do us a favor and like increase heart rate, decrease heart rate? You cannot. So that is under involuntary control. That's cardiac tissue. Smooth muscle, we talked about that. These are the hooks, the junctions. There's different types of hooks. Some hooks are tight junctions. You see, tight junctions, they hold. Look at tight. You see where my mouse is? Look at how tightly tight junctions hook together two cells. That's how tightly. Now look at how desmosomes, they still hook up the cells, but they allow a room for breathing. But look at tight junctions. See where my mouse is? Tight junctions, they staple them tightly. What they call tight junctions. But those are desmosomes. They allow for a little leverage. Please go behind the camera. Thank you. And lastly, you have these gap junctions from the name. Gap, like a tunnel. You see, they form a hole. So all these are proteins called connexin. You see connexin? Connexin. They make a hole. Through this hole, the cells send each other water, send each other electrolytes, send each other proteins, and so on. See, that's the tight junction. That's the desmosome, and these are the gap junctions. Glands. We said glands are important for secretion of important material or excretion of the waste. We have two types of glands. This is very quick now. Two types of glands. Endocrine gland, exocrine gland. What is the endocrine gland? What's an exocrine gland? Both of them secrete their substance. But where do they secrete it? That's the difference. Endocrine gland secrete the substance in blood vessels, in the blood. While exocrine glands secrete their substance in the duct. So let's look at them. There you go. Endocrine gland secreting the substance in the blood vessels, the blood capillaries. Endocrine gland, like is the pancreas endocrine or exocrine gland? Is endocrine because it secretes insulin and glucagon in the blood. What about when pancreas secretes pancreatic lipase that digests lipids in your intestine, in the duct? What is that? It's not excretion. because it secreted an enzyme. So that is, it did not secrete it in a blood vessel. It secreted insulin in a blood vessel, glucagon in a blood vessel. But it secreted the enzyme for digestion to help your intestine digest the food you ate. They call it pancreatic lipase, pancreatic amylase. They secrete it in a duct, so that makes it exocrine. So the pancreas is a two-in-one. It's the endocrine gland and the exocrine gland. So you see here, that's a blood vessel. We secrete our content in the blood vessels as endocrine gland, and we secrete the content in a duct as a exocrine gland. The general structure of the endocrine and exocrine glands. What happens here? Is this an endocrine or exocrine gland? This one. You see blood vessels in front of you. So that's the endocrine gland. But when you look here, do you see blood vessels here? No. What do you only see? Duct. That's a tunnel, a duct. So that's an exocrine gland. So when we look at the exocrine glands, how do they secrete? They secrete by three interesting modes. Please look at the three modes of excretion: eccrine, epocrine, and holocrine. What's the difference between eccrine, epocrine, and holocrine? Eccrine is when the gland releases the product by exocytosis. Like when you cry your tears, the pancreas secreting its substance. Like here, you see eccrine gland, you secrete, you empty, exocytosis your content into the outside. Epocrine is when you have lipid droplets covered by the membrane, and the cytoplasm is going to butt off as an entire lipid droplet. That's like the milk fat. That's an example of epocrine secretion. Holocrine secretion is when the cells accumulate a product and the entire cell is going to disintegrate. Here you have the oil glands of the scalp and the skin and the glands of the eyelids. Eccrine. So you see these are three modes of excretion. There's the eccrine mode, and here you have the vesicles that are full with their content to be secreted, like a tear when you cry. So what happens, the tear comes in a vesicle and buds off the surface. These little droplets represent your tear. That's how milk is made. When you have a fat lipid surrounding the milk, and then you release it as an actual droplet. And lastly, you have the holocrine. That's when the entire cell disintegrate, like when you have in your sebaceous gland, this fat and oil that's on the skin. Come on, 5 more minutes. Come on, we're almost there. Okay, what's hyperplasia? Hyperplasia is when you increase the number of the cells. When you were a baby, is the quantity and number of cells you have as a baby is the same as now? So the number increased. So that's hyperplasia. So cancer is an example of hyperplasia. Then there's hypertrophy. When you go to the gym and you lift weight, how does the muscle get bigger? Did you get more cells now? No. But the glycogen, the sugar inside the cells, got really stored bigger. That's why when you work out, you lose a lot of sugar from the blood. You drop your blood sugar. That's a good way to break down sugar because you take the sugar from the blood, you store it inside the muscle. And lastly, you have neoplasia. Neo means new. Neo. You know, neo, like neo-Nazis. But it's not neo-Nazis. This is neoplasia. So neoplasia, neo means new. Neoplasia is new cells. New cells that are new cell growth. So cancer is a new cell growth. It's a bad cell growth, but it's new. New bad cell growth. Neoplasia. What's differentiation? Differentiation is when the tissue becomes different from other tissues. When you have epithelial tissue, it fully differentiated now. When it differentiates into muscular tissue, differentiate into smooth muscle tissue. What is metaplasia? Metaplasia is when a tissue changes from one form to another. Like a compensatory metaplasia, somebody who smokes cigarette. When they smoke a cigarette, The nicotine goes inside the esophagus. So now the esophagus cannot bear that. So the tissue of the esophagus, the mucus, the ciliated tissue, is gonna what? It's gonna change into squamous to put up with this nicotine. So now these people who smoke, when they do an endoscopy, their whole esophagus has changed now. So the esophagus doesn't function well because it changed from metaplasia. What happens if they keep on doing it so even more and more? It becomes cancer. So you have metaplasia. The next step is anaplasia. Anaplasia is cancer. So regeneration, we discussed that. Growth by cell division. Fibrosis is replacement of the damaged tissue with scar tissue. So when there's a wound, we said there's different layers. The epidermis followed by the dermis. And the blood is going to now leak out, which may cause hypovolemic shock. So what happens is platelets are recruited in order to make a band-aid. Then the white blood cells are going to be arriving there to fight all of the microbes and remove the dead tissue, and then pave the path for regeneration. Then you're going to have remodeling and maturation. What is atrophy? Somebody who is paralyzed. You see that their thighs are so thin, very thin, like an arm. Why is that? That's an atrophy, because the muscle hasn't been stimulated electrically with the nerve, so the muscle degenerates. That's called atrophy. It's the opposite of hypertrophy with somebody who lifts the weights. Necrosis is pathological tissue death. We talked about gangrene, about the homeless woman who is now, all of her tissue is becoming gangrenous tissue. There's infarction and sudden death of the tissue when the blood supply is cut off. So this is a dry gangrene. Why are diabetic patients suffering from gangrenes most of the time? Because the blood is so full of sugar. Blood is so full of sugar. When the blood circulates, the sugar goes to the toes. The blood comes back up to the heart. Will the sugar now come back up to the heart? No, it's going to deposit and sediment and build up and fall in the bottom of the soles of the foot. Now all this sugar is going to build up on the blood vessels, build up on the tissue, build up on the nerve, and damage the nerves. So that's why they do a diabetic foot exam. And also happens in the retina. The sugar causes the rupture of the really thin pericytes of your retina. Is that clear? Okay. Any questions? All right, let me take the attendance real quick.